All right, okay, everybody, go ahead and get started here. We're just about 1 minute after 6 o'clock. Just wanted to make sure we had enough people logged in to see exactly what it is we're doing. I can't see you, but presumably you can see me. Hopefully you can hear me. My audio is working. I have someone checking on us right now, and yep, sounds like you can see and hear me. So just wanted to give a little overview of our vaccine, uh, really where we are and where we're going and what we can do. So most informative for you would be to ask some questions to us so that I can address those for you. But what we're a little bit about me is I'm Brian Bearie. I'm a physician. Emergency medicine is my background. After running several large emergency departments in the area here for about 15 years, I built an urgent care here in town, Yucaipa Urgent Care, and that's been open now for just about 10 years. I've been out of residency training for about 20 years, so the gray hair is real. I'm a resident here of Yucaipa, and we have 6 kids in the district of Yucaipa. Most of them now graduated, but we still have one last one getting through Yucaipa High School as a freshman. So we're very familiar with the school district here. We're very familiar with the community here, and having owned and operated the urgent care, I'm familiar with a lot of you as well, as a physician in town. So I think it's a good symbiosis for our clinic because we do provide the occupational health and the workers' comp for the school district to be involved with the vaccinations for those of you that choose to get them. And what we intend to do is make it easy for the district employees. We went live this week with vaccinations for the tier that is able to get them. Now, the tier that we're currently in are those that are over 65 or healthcare workers. So we're doing those on an appointment basis here in Yucaipa at the urgent care, and that went live today. And we expect the next tier to open up soon. Now, I don't have that answer. I don't know when the Department of Public Health will open that up, and it's up to each county. But each county, which makes us very unique, seeing how our school district crosses the county line, but each county will open up their window and allow us to test more people. Educators are in the next tier. So we're right on the cusp of being able to get our vaccines delivered to all of you. And we intend to work with the district to set up an additional vaccination clinic, probably somewhere within the school district facility, so that you don't have to make the online appointment and come into the urgent care. We can actually make this easy for all of you, and we're willing to do that. Just obviously we're vested members of the community, and we want to do what we can to help all of you get the vaccine if that's what you choose to do. I'm a proponent of the vaccine. That's my main message here today to convey. Your take-home message should be that yes, I think it's a great idea. There are really relatively few, if any of you, that would not be eligible to receive the vaccine. And those are the specific questions I'm happy to answer. I received the vaccine. I've actually received both doses already. Being frontline emergency medicine is my board certification, so I was able to get both doses already, and it went fine. I had no personal reaction. 4 of our kids are over the age of 18, and they work in healthcare. They've all received the vaccine. My wife, Julie, is a registered nurse, and she does the day-to-day operations for Yucaipa Urgent Care. She's received the vaccine. So we believe in it, and we're definitely practicing what we preach. But I do understand, and I do have friends and people do have concerns on whether or not this, what is this mRNA virus? How is it different than or the mRNA vaccine? How is it different than the typical vaccine that we've been doing? Is it safe? And I've done quite a bit of research on it. I personally received Pfizer, but the vaccine that we have right now is Moderna. So my family received Moderna. That's who we're giving to all the patients right now. The research on both of those is very, very similar. The Pfizer vaccine, the Moderna vaccine, and we're going to get allocations of each. Each drug company had to enroll about 30,000 patients for their phase 3 clinical trial, and Pfizer published a 91% efficacy rate, and Moderna was 94.5%. So they're both very, very similar. But if you're splitting hairs, then yes, Moderna is the one that is going to be slightly better, more efficacious, according to the large phase 3 trial that they did. And coincidentally, I'm part of that phase 3 clinical trial. I'm a principal investigator for Moderna. So you might wonder why I didn't receive the Moderna vaccine, but I didn't want to jump any lines. So I waited my turn, and I ended up by happenstance to receive the Pfizer. But we did not enroll any patients from YCJUSD. We enrolled them from my clinic in Sacramento, and we enrolled about 500 patients in that trial. And it was a double-blind, placebo-controlled trial. But because of that, I had to be very, very involved with all the the literature and knowing who's eligible and what we were really looking for. But it's out, and we've already delivered. As of yesterday, we vaccinated 10.5 million people with the Moderna vaccine and 13 million with the Pfizer vaccine. So our numbers are getting pretty big now. We're approaching 25 million vaccines administered, and there have been relatively very, very few adverse events. There were, we measure those, and those are on the CDC's website. But there are so many zeros in front of that number for any sort of significant adverse event. It's 0.00004%, which is extremely negligible, and that is a statistically significant, number to know that it's, the rate is very, very low. Most often you're going to have a sore arm, more so than you will with the flu vaccine. You'll have a sore arm. I feel like someone punched you in the arm. If you ever had a tetanus shot, it feels very much similar to that. Other than that, we've, of the 1,000 or so people that we vaccinated through my other urgent cares, we've seen 2 cases of a red inflamed injection site, and that's it. We haven't had any other issues, nothing that a Motrin couldn't take care of. So those that are eligible to be vaccinated are going to be, I would say, all of you. If you're pregnant, yes. If you're breastfeeding, yes, you can get the vaccine. If you intend to become pregnant, yes, you can get the vaccine. Really, the only hard stop that we use on our questionnaire to isolate those patients that are not eligible to receive the vaccine are those that have had a major reaction to a previous vaccination. So if you've received a vaccination in the past for hepatitis or polio, or you received the flu vaccine, or you received the pneumonia vaccine, and you had a major reaction, then we're not going to recommend that you get vaccinated with our COVID vaccine. Other than that, the only other population that we're excluding are those that received a monoclonal antibody, which is usually in an inpatient setting. So you received the drug Regeneron because you had COVID, and you will still be eligible to get the vaccine, but we give you a 90-day waiting period. That's all. So we take those patients, make them wait a little bit longer. I doubt any of you received Regeneron as an inpatient. That's a monoclonal antibody therapy for someone who's very, very sick. Usually the patients that are intubated on ventilators, that's what they're getting as an IV drip medication. They have to wait 90 days. And really the science to that is we heavily concentrated a lot of antibodies and gave them to these patients to help fight COVID. So now if we give them a vaccine, those antibodies are going to destroy the vaccine, so it won't work. So other than that, if you've had COVID recently, you can still get the vaccine. We just ask that you wait till you're asymptomatic and you're outside of your quarantine period. So usually that's a 10-day period and you're no longer with any symptoms of COVID, then you're eligible to get the vaccine. That's a very common question we get. More questions that we did have a few of them that were emailed to us ahead of this session, so I can read a few of these out loud. And we could take some live ones. I think Lance is on board. He'll help us get some live ones going as well. Let's see if we're unable to get the second dose, right? So that's an important question to know that, yes, this is a 2-part vaccine. The first vaccine is given on day 1. And we are starting to get more and more data now. Remember, we have 25 million doses delivered to date. So we're believing that we're about 70 to 80% immunized after the first dose at about 2 weeks. So there's a very good chance that you'll continue to have that very strong level of protection without even getting the second dose. But we're giving a second dose. The second dose presently is the exact same dose as we give as the first dose, and it's the same medication. Nothing different about it. So we give the same vaccine 2 times. For Moderna, they're 28 days apart. For Pfizer, they're 21 days apart. And that's up to us. We'll manage that for you. And if you choose to use us to get your vaccine delivered, and remind you when you get your second dose, and make sure that you actually get a second dose. But it's now after the second dose, the studies are what we've shown that's where we get our 95% level of protection. So down the road, I suspect that the dose delivered in the second dose will be less than it is now. And that's because I know from the inside track that Moderna's already applied for a half dose booster instead of the full dose. And there's even another chance down the road that they'll ask for a complete waiver on the second dose altogether. But because the trial that we performed involved patients greater than 18 and given 2 doses separated by 28 days, that's what we have to deliver. So we're just following the exact modality of how the trial was scripted. So you can get the second dose 28 days after your first dose. You can't get it any sooner, but you can definitely get it later. So if you miss that date and you wait a couple of days or a couple of weeks or even months, you can still get that second dose later. You don't have to restart the vaccination program all over again. But we're going to do our best to get you vaccinated within that recommended time frame and try and hit you right at that 28-day mark. The question here is, I already had COVID. Do I need to be vaccinated? Yes, the CDC still recommends that you get vaccinated because that case of COVID that you may have had may have been a very mild case. You may not have mounted a very profound immune response, and therefore you may not have much protection beyond a 90-day window. So even though you already had COVID, the CDC still recommends that we all get the same vaccine level so that we can develop that very strong level of immunity against future or further infection. And we can't tell you which is better, having the natural version of the antibodies from the COVID infection or having the vaccine. And we don't have the data to tell you which is going to be better. But what we're striving towards is a herd immunity. Herd immunity is just the term that you hear us talk about, where we can really disrupt the spread of the virus because so many of us are immune to it. And one of the magic questions there you hear all the time is, well, what percentage of the population needs to be immunized before we reach herd immunity? That number is not known. It's going to be high. I do know the number for measles. Measles was 94%. Once we immunized 94% of the population, we effectively eradicated the spread of measles from daily type outbreaks. So it'll be up there. It'll be 80s, 90s, and that's what we're going for, to try and get most people immunized. I'm going to read to see if we have any other questions that I haven't covered, because I was able to read these before I started, and I tried to incorporate those already. Should I receive the vaccine at the same time as other vaccines? Good question. And the answer to that is no. We like to, if you receive the COVID vaccine, you should wait 14 days before you receive any other vaccines. And if you received a vaccine within 14 days, you should wait 14 days before you get the COVID vaccine. So a real day example would be, you just received the flu vaccine last week and you're scheduled to receive the COVID vaccine this week. You should wait 14 days before you get the COVID vaccine. And we just don't want to overwhelm your immune response. Now, if you didn't know that and you received 2 vaccines within the same week, do you need to start over? No. We're just recommending that we try and spread them out at least 14 days apart. If you're allergic to medications, you can still receive the COVID vaccine. We only disqualify you if you've had a serious reaction to a previous vaccine. Some of these are questions that would be related to your school district, which you guys will have to address internally. And Lance, are we receiving any questions on any sort of live stream or chat that I haven't been able to follow up on?
We are. I have a couple of questions for you, actually. And if there are any questions that are directed for district leadership, they'll be added to the employee FAQs once they've been reviewed. So you can go ahead and keep asking them. We'll copy the chat down and make sure they get added. If someone is a resident in Riverside, are they able to come to the YCJUSD urgent care to receive the vaccine?
Yes, and that's hot off the press, because we have to work on a federal level, a state level, and a county level, and no one could give us the direct answer. And we're in such a unique situation, being split, that we're basing it on your employment. So we're going to use the same tier. We're hoping that Riverside and San Bernardino open up your tier at the exact same time. They may not. Soon as one tier is open, you're all going to be qualified, because we're fortunately getting allocations in each county, and your district spans both counties. So we received word just yesterday from the county health officer of San Bernardino that our allocation can be used for both counties. And that goes for the employee, the few of you that may actually live in LA County. You may say, well, I'm in LA County, that's where I live. Well, we're going to use your place of employment. So once we announce that Yucaipa-Calimesa School District, we're now going to give you eligibility for the vaccine, it applies to every single one of you.
Awesome, thank you. I have another one. Have there been any trials on giving the vaccine to children?
No.
Yet?
No. So Moderna was only in those over 18. Pfizer was those over 16. So that's what the approvals are for. Johnson & Johnson presently has enrolled children in their study. That's a single dose vaccine. It does not have emergency use authorization yet, but stay tuned, because that's probably within a few months that it will. But those are the target populations that they'll be using for those under 18 and under 16.
Okay, and then one more question. Is it going to be a continuing vaccine, something that we'll need to receive boosters each year for, or is it going to be a sort of a one and done? You get your 2 doses and you don't have to worry about it again?
We're very, very hopeful it's a one and done. You get your primary, and then you get your booster at 28 days or 21 days, depending on which manufacturer, and that's it. So other examples are hepatitis, polio. These other vaccines we received, we no longer have to give boosters for those, that we have a lifelong immune response. That's the high level literature that I have access to is we're really, really confident that it's going to be one and done.
All right, thank you. Will you offer a patient dose 2 if they've received the first dose someplace else at YCJUSD urgent care?
Yes, absolutely. Yep. It doesn't have to be given. You can get it at your doctor's office for dose 1, or you could go to Dodger Stadium for dose 1. And then we just received our doses yesterday, or we received them yesterday midday. We went live with them today. You can get your second dose here.
And then I have one more. If somebody comes in, I know there's been some concerns about people receiving the first dose and there not being enough of the second one. Is it guaranteed that someone would receive the second dose if they get the first?
Yes. The county, despite what you see on the news, they're saying, well, there's all these shortages, we're not delivering enough vaccine. We're on a supply chain. So presently they allocate a certain number to us each week. And at week 4, that allocation doubles, so that we can handle the first dose for the second, you know what I'm saying? The first dose for those ongoing future, and then the second dose for those that now we need to catch up with.
And then if you receive your first dose and say it's Pfizer, would you be eligible to receive the Moderna booster, or you have to stick with Pfizer, Moderna?
You have to stick with the same manufacturer. They're both mRNA viruses, vaccines, but we're not crossing manufacturers. Now, I've been in closed doors meetings where we say, well, what happens when, because it will happen, because someone's going to confuse, oh, I forget which one it was, and they'll just make it up, and we give them the second dose. There's still going to be a positive immune response, but stick with the same manufacturer.
And then there seems to be a lot of concern about the vaccine being given to women who are pregnant or breastfeeding. Do you feel very confident that the data supports that it's safe for them?
Yes, there were enough patients in that phase 3 clinical trial that were pregnant and breastfeeding to record no adverse reactions, and that's a very, very confident area. That's not a gray area, and people do ask, what am I getting a live virus? Are you infecting me with COVID so that I mount an immune response? And the answer is no. What the mRNA is, it's a messenger RNA, so it's a single strand of RNA that we administer. It's not live. What that does is it elicits your body to produce a protein similar to the COVID protein that's on the outside of the COVID virus. And then your body mounts an immune response to that. And so then you maintain those immune IgG and IgM antibodies hopefully for life. But it's not a live virus we're giving. We're not infecting you with COVID.
Can a person who had GBS get the vaccine?
It's not listed as an absolute contraindication. But I would have a discussion with my Guillain-Barré syndrome patient who is reluctant. I mean, their neurologists are really the ones that should make that decision. And my neurology colleagues are very hesitant to give vaccines to patients. Guillain-Barré syndrome's pretty rare. Those patients know who they are. So we're not looking for them. Those are the ones that have been empowered with the knowledge to know, like, hey, listen, future vaccinations for you might be a risk. So that would be an individual decision on a case-by-case basis.
Okay, thank you. Is there a difference between side effects of the manufacturers? Does Moderna show certain side effects, or does Pfizer?
They're very similar. We look at side effects, and then, of course, we use the term reaction to something bad. So if someone has a reaction to the immunization, they had an anaphylactic reaction, that's when we we'd give them a little bit of an EpiPen or give them a little bit of epinephrine, and those are very, very rare for either. And we carry those medications on site. If we were to come to your school and administer vaccines on site, we'd carry the epinephrine with us just in case there was a reaction. Most people don't have reaction, right? That's, very, very negligible number. It's side effects. The side effects are pain at the injection site. And that's going to be common within 24 hours. A little bit of redness, not so common. Some people will have minor body aches, they think they have a fever, but you actually don't mount a fever, but you'll feel a little feverish for about 12 hours. But again, this is the minority of patients. It's not a majority. It's more often after dose 2 than dose 1. Dose 1 seems to just go seamless for almost everybody. Dose 2, now you already have the antibodies. So we give you the booster. And so your body mounts a very mild immunologic response to dose number 2. So you go through about 12 hours. You can, but it's about 40% of patients will about for 12 hours that they'll get a little bit of very mild type symptoms. But these are so small that it's not going to disrupt your normal daily flow. It's not going to disrupt your being able to go to work or your regular activities of daily living. It's very, 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 very mild.
Okay, that's good to hear. I know you mentioned the Johnson and Johnson vaccine a little bit earlier. Do you have any idea if there's a potential date for the Johnson and Johnson vaccine to roll out?
Still months. We're not within the weeks. They haven't hit their critical number of patients that they have to enroll in the trial, but they're on schedule to have a vaccine within a couple of months. And there's a couple other smaller manufacturers right on the heels of them as well.
And then after being vaccinated, after receiving your second dose, is there a decent amount of evidence that you become immune, or are you still considered a carrier?
No, there's great evidence to show that after both doses of the vaccine that have a positive immune response. So we can measure antibodies in you. You're going to effectively not get COVID the vast majority of time, 95% or so. So you personally are covered. So you will not get the disease. Now, being a passive carrier, that's still a gray area. You're not going to get it, reproduce it in your upper respiratory tract and sneeze it all over the place. That's not what's going to happen. But you could still have live virus on your body and be a fomite, meaning you're now transmitting it not because you're infected with it, but just because it's on your person. So that's why just because you've had the vaccine, the CDC says, well, that's great, but you still have to wear your face mask. You still have to do social distancing. You still have to be careful because the virus is out there until more and more people are immunized. And then the virus no longer has a safe haven to reside. We've effectively eradicated its hosts. And once we do that, then we could get back to normal.
Do you know what the CDC's goal is on what percentage of the population they want vaccinated prior to us being able to sort of come out of lockdown, stop the masks?
It's a question asked every day, and it's a secret. They won't tell us. Yeah, I don't know. We're getting out. We're doing 6 million vaccines a day, and we're supposed to double that soon. So there'll be a critical mass that gets reached here. I'm very hopeful very soon where we can start to back off on all these other restrictions.
And once people receive the vaccine, once they've received both doses of the vaccine, and if they start to show symptoms for COVID-19 a month or two down the road, would you still administer a COVID test when they come into the urgent care?
We would, because it's something that you would want to know. So the new tests that we're doing are COVID, flu A and B, and RSV. So it's a triple test. So you come in with upper respiratory symptoms, we'll still do the real simple, easy nasal swab, and we'll run that. And then we can tell you that, hey, it's not COVID, but you do have the flu, or it's not the flu or COVID, but you have this other virus. So we're starting to really identify what it is you have. So it's knowledge, that way you know what you don't have and you know what you do have, but they're all spread the same way. So we've seen hardly any flu this year because of all the measures that we're all undergoing right now. Everyone's using hand sanitizer and staying away from each other. So flu this year, it went from, I was diagnosing out of just yucaipa urgent care, probably 10 a day last year at this time. I haven't even diagnosed 10 for the entire season this year.
Wow. For the Johnson and Johnson vaccine, do you think it is going to be better than the Pfizer or Moderna, or do you think it's going to be
their advantage will be single dose? So that's great. You don't have to come back in 3 or 4 weeks. But what we don't know, because they haven't shared their data, we don't know what their efficacy rate is. So if they're up there in the 90s, like Pfizer and Moderna, then yeah, let's go with with the J&J. But until then, we don't have access to it, so we're using what we have.
Okay, thank you. Should people with COPD, asthma, or severe allergies get the vaccine?
Yes, absolutely. And when we say severe allergies, it's not allergies to vaccines. It's just allergies to environmental type causes, or you can even be allergic to medication and still get the vaccine. But yes, those patients, those with any sort of comorbidities such as diabetes, heart disease, COPD. This vaccine is very, very effective. In the original trials, there was a large percentage of almost 40% of the patients that were in the trial had comorbidities such as diabetes, heart disease, COPD. So it's been very well studied in that patient population. And we're very confident that those patients benefit from the vaccine, not to mention those are the most vulnerable.
And then how about how the virus mutates? There's all these reports of new strains out there. Is the vaccine still considered effective against the new strains that are coming out?
Yes, the 3 strains that have been globally identified and looked at have all been positively addressed with the current Pfizer and Moderna vaccine. I can't say
Great,
what's going to
thank
happen in another couple of months if there's some super strain that evolves. But presently, the immunoglobulins that we're producing, the long-term ones, the IgG against the coronavirus, have been effective against the 3 different strains that we've seen.
And then just to clarify on who's eligible for the vaccine right now at the clinic or in San Bernardino County, are you only administering it to those 65 and older, or would someone else be able to come in right now?
Healthcare providers and those over 65 as of today. And they don't give me any heads up any further than any of you get. I read about it on the news when the tiers move, but I do look every day because I know that we're going to move to the next tier very, very soon because they keep telling me to be very, very aware. So we're checking the county websites every day. Once it does, we'll put out a mass press release too, because that next tier is you.
That's good news.
Yeah.
Are they just waiting for more doses of the vaccine to be distributed across the U.S.?
That's my personal belief is they just wanted, of course they wanted healthcare workers, frontline people, those at the most at risk, like nursing home residents and those over 65 vaccinated first. But at the same time, they've been, trying to roll out warp speed and getting the vaccine in the hands of those that are distributing it and administering it, such as us. And that took a while and we were frustrated. Here we are, a month after I got my dose, I still wasn't able to administer it to patients, but they finally have the supply chain moving forward. So now that clinics such as ours has it in their inventory, I believe that they're going to start moving the needle on those tiers.
And then for long-term storage, if you were to receive a large amount of doses of the vaccine at one time, is it fairly easy? Are hospitals and urgent cares capable of storing the vaccine?
I am, which may be one of the reasons why we received an allocation early. I have a -70 freezer, a very large one, and we have a -20 freezer, and then the regular. But the way that these vaccines are delivered is if it's a Pfizer vaccine, it's frozen at -70, and we store it at -70. But once we thaw it, then we still have 30 days to use it. So it's really, the ones we're using right now, we're not even keeping in deep freeze because unless they give me 100,000 doses, I know I can use whatever I get within 30 days. So we're just keeping ours in actually in refrigerator temperature right now because we have 30 days to do it at refrigerator temperature.
And then for once we move forward into the next tiers and they're able to get the vaccine, can those that were originally in the first tier still come and get the vaccine, or are they going to be placed? Is there going to be like a priority system?
It'll be wide open to everybody. So we'll just have more people eligible to get the vaccine. So even those in the original tiers, the healthcare workers, the elderly, they'll still be able to get it if they haven't had it yet. And then now it's going to be food service employees, educators, transportation, manufacturing. It really opens up to a very broad category very quickly.
All right, I'm not seeing too many more questions rolling in. I think you covered a lot of them. Is there anything else that you'd like to share with us about the vaccine or even about your center What?
My introduction, I opened up with what my take-home message was going to be, and I kept it simple. It was one-liner. I believe in the vaccine, and I practice what I preach. Not only did I get it, my whole family's gotten it, and um, I hope that the vast majority of you decide to get it as well. It's gonna be what gets us back to normal. This is what's gonna get us reopened. I see it, and I believe me. I've had my skepticism and my own political viewpoints here and there, but this vaccine is I've embraced it, and we're moving full speed ahead.
And then can I get some clarification on something from earlier? Can someone get the vaccine after their 10-day quarantine time is over, or
Yes.
is it 90 days after?
It's 10 days. So if you're out of quarantine, which now we recommend it's only a 10-day quarantine, you're no longer quarantined for 14. That's been reduced to 10. You're quarantined and you're asymptomatic, you can get the vaccine.
Okay, great. I know that you said you're offering Moderna at your clinic, but in the future, do you see people to have a choice between Moderna or Pfizer?
We're received our first allocation, and it is what it is. I could see getting doses of Pfizer down the road, and at that point, I would, if I had both Pfizer and Moderna, and a patient had a choice, we'd let him make the selection.
Then how about those undergoing cancer treatment? Would it be positive for them to receive the virus, or should they wait?
Yes, no, they're still recommended
Or the
to
vaccine,
receive
excuse
the
me.
vaccine. It's still recommended, of course. If you're, an active patient of your oncologist, we always recommend that you, get, counsel. But at the same time, I know their answer. And it has been a very strong yes. You are very at risk, and you need to get the vaccine.
And then I know we've covered side effects, but specifically for women, are there any side effects that they could experience that would be separate from what men might experience?
Nope, nothing that's gender specific or related that I've seen, read, or heard of.
And then how about if a non-YCJUSD employee, someone not working for the school district, if someone is going to come and receive the vaccine and it isn't being funded by their place of work, how would they go about paying for it? Is it covered by insurance, or is it a state
Yes.
covered cost?
All insurance is covering it. They're mandated by the federal government to pay for the administration. The actual vaccine is free. The vaccine has been distributed to all the clinics, healthcare providers, hospitals at no cost. So the vaccine's free. It's the administration fee it's really small. So not even an office visit. It's very, very small. But that's paid by either your insurance company, and if you don't have insurance, then we would bill the federal government and get that equivalent of an administration fee, which covers the nurse's time, the observation time, the supplies involved. Again, it's nowhere near an office visit fee. This is not a profit service line giving vaccines.
If you have a suppressed immune system, are you still safe to receive the vaccine?
Yes, even those that are immunosuppressed, such as those undergoing chemotherapy, radiation therapy, or on immunosuppressant medications, it's very recommended, highly recommended that you get the vaccine, which is that's one of the major advantages of this being an inactive vaccine, meaning it's not a live virus, because those patients were not able to get live virus vaccines. But since this is a messenger RNA vaccine, that it's just it's designed for people of that background.
And then if we were to visit Yucaipa urgent care to receive the vaccine, either dose, about how long do you think we would be there?
Oh, you use it. It's an appointment. So what we're doing for this, because if any of you've driven around my office in Redlands or my office in Yucaipa, maybe the last few weeks seen the lines, right, for testing. Well, those lines have now pretty much diminished, not very high demand anymore for testing. Now it's for vaccine. But the vaccine we're doing on an appointment only basis. So you go to our website and you pick a spot, and there's every 5 or 10 minutes, there's a vaccine slot open. And we've brought in extra staff and a whole vaccine clinic. And so that way you know your appointment, and you'll get a text confirmation of your appointment. And then you get a text reminder of your appointment. So it's actually very efficient. So if you have an 11:30 appointment, you'll get a text reminder that morning. Hey, remember your appointment's at 11:30. You come in at 11:30, and our vaccination team is ready for you. You get your vaccine, you're out of there. So you don't need to see the provider. It's a very short, abbreviated 5-minute visit.
I've used your appointment system before, and scheduling it online and receiving the text is great. You're in and out of there really fast.
Good.
I appreciated it.
It's good feedback.
So our questions have pretty much slowed down. There's a lot out there that are being, directed towards district leadership, but there are so many people out there giving you big shout outs and saying thank you for spending time with us and taking the time to answer these questions. I appreciate it. I know all of our employees appreciate it. Superintendent Binks, she said thank you in the chat, along with about 50 other people. So your time tonight is greatly appreciated.
Oh, you're very welcome. Happy to help. We're happy to be involved.
It's been extremely helpful, and I think it's cleared up a lot of things for a lot of people. I know that a lot of questions I had were answered just through people questioning in the chat, and I think it was good for everybody to kind of start bouncing in the live chat.
That's right. Great. Well, let's get vaccinated and let's get back to school.
Oh, I do have one more for you. The CDC is reporting that Pfizer is more effective than Moderna. Is it just that minimal amount that you were referring to earlier? Yeah,
well, if we use their original phase 3 clinical trial, the Pfizer reported a 91% effective rate with their immune response, and Moderna actually reported higher at 94.5%. So now they're getting validated, as we're starting to check antibody responses down the road. They're still neck and neck. They're within, well within a standard deviation of each other. It's negligible. So people are going to ask, should I get Pfizer? Should I get Moderna? They ask me that all the time. Well, right now we don't have a choice. But the early data has shown that Moderna is, a little bit ahead of Pfizer.
All right, thank you for answering that last question. Looks like people might be starting to sign off, and
good. All right.
I think if you have any other tips that you want to share, that would be outstanding. Otherwise, thank you so much for your time. We all greatly appreciate it. If you go back and watch this YouTube video, I'll share the link with you so you can review it if you want to. The amount of comments in there that are big shout outs going to you. There's an incredible amount.
Great. Thanks for the feedback.
Absolutely. Thank you so much for your time. And if you don't have anything else for us, I'll go ahead and we'll close it down.
Yeah. Thank you for everyone. Thank you for everything that you're doing. I know it's tough and trying times for all of you. So hopefully we can all get back to school soon and see each other and get some more normalcy. But thank you. I know you guys you've been throwing a lot of accolades towards all the healthcare workers, but I want to give it right back towards all our entire education team. So thank you, everybody.
We all greatly appreciate you. Thank you.
All right, you bet. Bye.